All right, welcome back to the Quad Matrix Q&A. Today we're going to be discussing the quad wedge. One of the major points of the quad matrix system is allowing the wedge and the ring to work together. So we call that wedge ring synergy. And if you look over here, you can see the different quad wedges that we have. The small is blue, the medium is orange, large green, and this purple one is called the anatomical. And if you look carefully at that anatomical, you'll see it's got like a small convexity or hump on the outside of the wedge in the middle, and that's made to engage the mesial of these bicuspids that are distal to the canines because they often have kind of interesting root shapes and root concavities. So that anatomical wedge is made to help you get in there. Now, if you look at the quad wedge that we have in position here, you'll see that as the wedge is placed, one of the unique features of it is that these tips that are open, you'll see that the quad wedge has splitting tips here. They're allowed to go in different directions. And so this is going to allow your wedge tip here, this flexible wedge tip, to seal the gingival margin of the preparation should it extend more palatally or buccally, because the teeth are not straight in that area, they're curving. And so one thing that we often get is that, are these wedges firm enough? And if you look at the design of the wedge, the body of the wedge is solid underneath near the handle, which is what's engaging the teeth. And then those splitting wings are flexible. That's going to allow the ring to engage those to seal the gingival margin and give you a perfect contour in your matrix band. So we're just going to place the quad ring over the quad wedge here quickly just to demonstrate. And so the driver tip of the quad ring is just going to go right in the middle of the splitting tips of the quad wedge, like so. And you can see as I do that, you can see those flexible tips, how the ring is able to apply its pressure to those flexible tips and seal the gingival margin all the way around and in this gingival embrasure space. And so while they may seem not very firm, they don't need to be in that area because the ring is doing its job in that section while the body of the wedge is actually engaging the two teeth near the buccal. And that is the quad wedge.